Come Care With Me was created to provide Pennsylvania legislators with a hands-on, real-life understanding of the work that direct care workers do every day and the challenges they face. One of the great ironies of our healthcare system is that many of those workers who are providing the home and community-based care that millions of Pennsylvanians depend on each day cannot afford to have health coverage for themselves.
I think you hit on the key point that the state's trying to shift from a situation where folks are going into homes, into hospitals, to caring for them at home. And I think it's a tremendous advantage, and we need to make sure at the state level we're providing support, whether it's health care coverage or other support.
It's been estimated that by the year 2016, Pennsylvania will need an additional 43,000 direct care workers, a total of over 200,000. to meet the growing demand for home and community-based services.
But I can't restrain myself because I need these people for the work that they're doing for me. I must have them. There's no substitute for them.
Low pay, insufficient training and support, and lack of health insurance coverage for these workers means that many leave the work they love for less meaningful jobs that offer better pay and benefits.
For years we've been trying to work in the legislature to increase compensation, make sure that these employees get health care, problems that have been chronic for years and years, and we really haven't had the ability to get it done.
Additionally, there's just not enough new workers entering the profession to provide the consistent, compassionate, and skilled care that Pennsylvanians need now and will need increasingly in the coming decades.
In an environment where we know, where the more and more elderly are trying to live in the community, disabled people as well, that this workforce is absolutely critical in order to provide care for these folks in probably one of the best ways you can provide care in somebody's home.
One thing about this whole issue is that with an aging population that we're going to need more healthcare workers, and for healthcare workers to make a lower amount of money to be able to afford their own benefits, not only medical but dental, vision, those kinds of things that come out of the salary. I mean, it's very, very important.
Through Come Care With Me visits, legislators were able to talk candidly with direct care workers, consumers, and their family members about the crucial role direct care workers play in Pennsylvania's healthcare system.
It was very eye-opening. I mean, it was, it's definitely getting in there and getting your hands dirty and doing what needs to be done. And I can only imagine what it must be like doing that for 4 people every day and having to be kind of such a support system for them. It's gotta be tough, but at the same time probably pretty rewarding. Knowing a guy like Larry, where would he be without somebody like you, to help him out on a daily basis?
I don't show up for work. Larry don't get to work, and my other consumers that I have, they don't get, they wouldn't be able to do what they do throughout their day.
She comes in, gets me up, gives me a shower, gets me up, dresses me, feeds me, and then I'm at the door around 8:30, 9 o'clock.
For those of us who get up each morning on 2 strong legs, the services that Karen provides to Larry might be hard to imagine. But for Larry, they make a huge difference.
Give me your pointer finger.
It's right there, my boo.
Quality care for elders and people living with disabilities involves so much more than clinical skills. It's also about compassion and respect.
There's nothing more intimate than a one-on-one employee, and they're providing intimate care, which Bob. And so you need to have a good working relationship with them, and it's tough at times. And I know because I hold my tongue sometimes because maybe I want to say something, but I'm not interested. It's almost like your relationship with your family, with your wife or your mother or your children.
Some people, their families aren't with them very much, and so they're so happy to have someone to talk to and to be with and to hold them a little
Yeah.
bit, you know, and
No, I bet that's the case.
the tenderness and the touching. And
Our elected officials are starting to get it and realize the crucial role direct care workers play in Pennsylvania's healthcare system.
Or whether it's through support of the direct care workers and enabling the providers to retain and recruit individuals like Faye who, you know, provide a tremendous resource. And I think that'll be the question that we have to, policymakers have to address going forward. What's the role for the state? Is it in, you know, direct payments to the families? Is it providing support for the direct care workers, or probably a mixture of both at the end of the day? But I think that's the question and the issue that we're going to have to face, because, you know, I think rightfully so, there is an emphasis on home-based care, but we need to make sure that we provide the support in those situations as well. I mean, you can't do one without the other.
It definitely is, you know, raised, you know, made me understand better the, you know, the situation, you know, with the healthcare and how, you know, how important it is. Like I said, you were lucky because, you know, you were highlighted and someone stepped forth and offered you healthcare. But if you didn't have that, you shouldn't have to, you know, we shouldn't have to make an example out of somebody in order to be able, you know, it should just be something that should be a given.
So we'll see, but I mean, ultimately, you know, the things that the Healthcare Foundation is doing with Health Career Futures is important, but in the short run, things like trying to increase compensation for direct care workers and provide health care has just been a chronic, persistent problem that there has been, at least rhetorically, bipartisan support for. But ultimately, when we come down to the final point of doing our budget, you know, we've just not come through in a meaningful way.
If Pennsylvanians really want to ensure healthcare choices in the future for themselves and for their loved ones, we need to begin caring about our caregivers today. One of the first steps to help stabilize and develop the direct care workforce is to ensure that these workers have affordable health insurance coverage.
I do believe that the direct care workers should have higher wages and should have health care and should have sick time off. And I recently, you know, had just gotten health insurance, but I still believe in the direct care workers having health insurance so they can take care of their own health, so they can continue taking care of their consumers.
let's face it, home health aides, we're not at the top of the wage earning.
Go over here.
And to have to pay for your own health care is just really impossible.
By accepting the invitation to come care with me, Pennsylvania State Representatives Jesse White, Dan Frankel, and Matt Smith not only had the opportunity to meet with some very special individuals in their district, they also heard loud and clear that coverage is critical to care.